Hello everyone. Gagwego scano. Agi jangwa gagwego. Jo hioaje od gononyo. Da one. Dango diogod. De en od neojan. Helwe. Ganon de guata. Going into the holidays, as COVID numbers were steadily increasing throughout the region, we knew there was a risk for further escalation in the number of cases in our nation. Unfortunately, that risk has materialized. As of today, we have 238 active COVID cases in our community. In Allegheny, 34 cases were detected through the Allegheny Health and 57 through our CTS testing sites. In Cattaraugus, 14 cases were detected by Cattaraugus Health and 133 by our CTS testing. Our overall positivity rate for testing is near 15%, and we're not alone. Erie County reported approximately 2,000 new cases in just one day over the weekend. The county's positivity rate was near 20% as the calendar turned into 2022. These are startling and worrisome numbers, and they are indicative of just how contagious this virus is, especially with the Omicron variant driving record numbers of daily cases locally, statewide, and across the country. This situation demands our attention and action on a personal level and as a nation's government. To help strengthen our detection efforts, we continue to offer and expand testing in our community. In Allegheny, CTS testing, with both rapid tests and PCR tests available, takes place 7 days a week from 3 to 7 p.m. However, the testing site has now changed to the ACC, located at 3677 Administrative Drive. Attendees should use the back parking lot and entrance. This testing is open to everyone in the community, and appointments and insurance are not required for the CTS testing. Starting this week, we've also added an additional daily testing option for our enrolled Senecas. Drive-through PCR testing by Bluestone is now being offered at the Allegheny DPW, located adjacent to the ACC, from 4 to 7 p.m. Photo ID is required, and access to an email and/or electronic device is required for all PCR test results. Again, this drive-through PCR testing is scheduled for only enrolled members of the Seneca Nation. In Cattaraugus, daily CTS testing is also available 7 days a week from 1 to 7 p.m., with both rapid and PCR tests available tomorrow. Beginning this week, the Cattaraugus testing location has now been changed to the Seneca Fire Station 2, located off of Route 5 behind the Gilley Arena. Traffic for this site should enter from Lucky Lane or the Bingo Hall entrance. This daily testing is open to everyone, and appointments and insurance are not required. We will also be distributing home testing kits to enrolled Senecas tomorrow, Wednesday, January the 5th, from noon to 6 p.m. This drive-through distribution will take place at both the ACC and CCC, and again, is for enrolled Senecas only. Additional at-home test kits will be delivered to Seneca elders who receive home meal deliveries from the AOA. For more information on our testing options, please contact Mike Gates, Emergency Management Director at 716-244-0820, or check out the information on our website at sni.org. Along with testing availability, we've implemented some additional COVID measures for our nation buildings and employees. I announced at the start of the week that all Seneca Nation employees must provide valid proof of COVID vaccination or a test that they have not been fully vaccinated. Any employees who are not fully vaccinated will be required to submit a weekly COVID test. The same requirement also applies to consultants who perform work on site in Nation facilities and have direct interaction with Seneca personnel or community members. In addition, we're implementing travel guidelines. With case numbers running high, we do not recommend personnel travel at this time. Vaccinated Nation employees who choose to travel will not receive admin time for travel-related quarantine, evaluation, or required COVID diagnosis/isolation at this time. Travel guidelines will also be implemented for vaccinated employees for any required business-related travel. We're also restricting access to Nation facilities to appointment only. These policies are effective immediately and are being enforced to help ensure that our employees and our facilities remain open and safe as possible during this current upswing in cases. Along with these measures, it's imperative that everyone continues to follow all public health directives. Again, those include the masks, the social distancing, the regular hand washing. If you're not feeling well, again, please stay home. If you're showing any symptoms whatsoever, please get tested. And of course, we want to encourage everyone who is eligible to please get your COVID vaccine. You've heard the statistics on what we're facing in the community. The spike in the number of cases has been drastic, and we don't want to see any more people getting sick. If you haven't received your vaccine, or if you're considering a booster dose, please make your appointment today. Vaccines are available for anyone age 5 and older through the Seneca Nation Health System. To make your appointment, call Terry Cowles in Allegheny Health at 716-945-5894, Kim Bradley in Cattaraugus at 716-532-5582, or you can complete the online form at senecahealth.org/vaccine. We all have to do our part in protecting our community and one another. As we continue to monitor and address the COVID situation in our nation, please stay connected to our website and our social media channels for any new information and updates. Finally, our first regular council meeting of the new year is scheduled for this Saturday, January the 8th at 9:30 a.m. In keeping with the policies I outlined earlier, this meeting will be virtual participation only. It's in order to protect everyone's health and safety. To register for virtual participation, please send an email to sngotomeet@sni.org with your name, nation ID number, a phone number, and the meeting date and time. We all hope that this COVID wave comes to a quick end. Working together and following protocols gives us the best chance to make that happen. We appreciate everyone's understanding as we navigate this situation. Have a great week, everyone. Please stay safe, stay strong. Dani Hodiet.